If you're a woman taking prednisone, you need to know this. Researchers have discovered, if you're a woman taking prednisone, you need to know this. Researchers have discovered that side effects are worse in women than in men. Women experience side effects 95% of the time, compared to just 81% of the time in men. But it gets worse. 77% of these women found the side effects intolerable, whereas only 50% of the men found it to be intolerable. Hi, I'm Dr. Megan, the Prednisone Pharmacist. I'm a third-generation pharmacist and board-certified doctor of pharmacy. And today we're diving into the research on gender differences in prednisone side effects. Which ones hit women worst, why this matters, and what you can actually do about it. For years, doctors and patients have guessed that prednisone side effects were probably worse in women than in men, that women probably experience them differently than men, but nobody really studied it systematically, scientifically, until researchers at the University of Alabama and George Washington University decided to look at the myasthenia gravis patient registry. I'm going to call myasthenia gravis MG from now on because it's such a long and hard word to say. This study, published in 2018 by Lee and colleagues in the journal Neurology, Neuroimmunology, and Neuroinflammation, surveyed 398 patients on prednisone or who had taken prednisone with the disease myasthenia gravis. Among them, 173 were men and 225 were women. Now, you might be thinking, MG is a very specific autoimmune condition. Do the results of this study even apply to me if I don't have MG? And yes, even though prednisone can be prescribed for many conditions, these results apply because the side effects can be the same, whether you happen to be taking it for MG or rheumatoid arthritis or lupus or PMR or asthma. The list goes on and on. The side effects don't care what you're taking it for. The numbers are striking though. Here's what they found. When asked about experiencing any side effects from prednisone, 95% of women reported side effects compared with 81% of men. That's already a significant difference. But when they asked which side effects were so bad that they were intolerable, that's where the gap really widens. 77% of women said they experienced intolerable side effects compared with 50% of men. Think about that for a second. More than 3 out of 4 women on prednisone found the side effects to be intolerable, where only half of men did. That's not just uncomfortable, that's life-altering. So, which side effects did they find in the study that hit women harder than men? They asked about 33 potential side effects. In the study, women reported more of almost every side effect, but some side effects really stood out. Women reported all of the following side effects more frequently than men: weight gain, increased appetite, changed appearance, moon face, prominent scars, increased hair loss, gingival hyperplasia. That's when your gums get swollen. Mood swings, depression, fatigue, poor concentration, headaches, sleeplessness, and palpitations. Now, when they asked which side effects were intolerable, meaning bad enough that the patients either want to stop or decrease the dose of prednisone, women specifically mentioned weight gain, changed appearance, moon face, depression, fatigue, mood swings, increased hair loss, sleeplessness, and stomach complaints. Do you notice the pattern here? A lot of these are related to your appearance and how you present yourself to the world. And that's actually really important, which I'll explain in a minute. What's really sad to me is that some of these side effects are actually preventable. Sometimes it really is what you don't know can hurt you. I've discovered that there are more than 7 common mistakes that people make when it comes to prednisone, and many of them relate to the complications of taking prednisone. So that's why I created the Prednisone Checklist. It includes my top tips for how to prevent prednisone side effects and how to avoid those top 7 mistakes. So you can just click the link below to download it now. Back to our study. Why does this happen? Why do women have more side effects than men? The researchers proposed several explanations, and I think a lot of them are valid. First, there's the body weight issue. In this study, the average highest dose of prednisone taken was about the same between men and women, but women generally weigh less than men. That means women are effectively getting a higher dose per kilogram of body weight And we know that higher doses equate to worse side effects. Second, there are pharmacokinetic differences. That's how your body processes the medication from mouth to anus or urine. Studies in healthy volunteers and transplant patients have shown that women, especially those on things like oral contraceptives or hormone replacement, have lower prednisolone clearance. That means the drug stays in your system longer, leading to higher side effects, more exposure to the drug. Third, women in this study generally had more severe disease than the men. More severe disease might mean higher cumulative steroid dose over time, the exposure over time, even if the current dose looks the same. But here's the fourth factor, and I think this is crucial. The researchers noticed that side effects related to physical appearance were noted as intolerable more often by women than by men. Weight gain, moon face, acne, hair loss, all are dramatically more distressing to women. Meanwhile, side effects that are neutral to social interaction, like palpitations, chest pain, poor vision, or infections, were considered intolerable at similar rates between men and women. Does this just mean that women are more vain or more likely to complain and bothered about things? Absolutely not. What this means is that women face real social stigma and social consequences from visible steroid side effects that men simply don't face to the same degree. Research on social networks shows that women maintain more social contacts, communicate more frequently, and work harder to stay connected socially. Studies of Facebook networks show that women are more aware of their visual appearance in social contexts, not because they're vain, but because society judges them more harshly for it. When prednisone causes weight gain, moon face, acne, hair loss, belly weight gain, women face real social stigma, discrimination, and judgment that affects their relationships, their work, and their quality of life. This isn't being overly sensitive. This is experiencing real consequences that the medical system has historically dismissed as cosmetic. I want to share my personal experience here. I took prednisone. And at the time, my doctor had said, okay, I'm going to taper you off around Christmas time. You'll be done. Here's my Christmas present to you. I was like, that's fantastic. Because they've scheduled my medical school professor interview for Valentine's Day. So I've got between Christmas and Valentine's Day to lose the prednisone weight. I just barely lost the baby weight gain before I started my prednisone before Halloween. And so I was like, all right, I have this chance to look my very best when I go in front of very intimidating medical school professors, students, faculty, everything. I was excited, but terrified. But I knew I'll be off prednisone and have time to recover. But then my disease decided to flare again. And instead of being off prednisone, I went on even higher doses of prednisone. Now I didn't just have a little bit of weight gain, I also had moon face. So instead of going into that medical school looking like my confident self, the person who I consider myself to be, I went in there with moon face and a belly weight gain, making it harder to feel confident in my beautiful suit. I went in there and I did it anyway. I nailed that interview and they offered me the job to teach pharmacology to medical students. It was a dream. I was thrilled. But it was that much harder because I had to overcome the stigma of not looking my very best. And it's not just me. Other people have told me that they're taking prednisone and they're like in public relations, they're on camera, they're performers. I have a friend who was an actress and then had horrible asthma and has had to go on humongous doses and now has gigantic moon face and belly weight gain. She doesn't look anything like herself. How is she going to land a job as an actress when she looks completely different than herself even just a few months ago? People think it's her fault, but it's not. It's the medication she's taking to literally save her life. If she wasn't taking it, she wouldn't be able to breathe and she would probably die. So here's why this really matters and where it gets serious. The researchers found something that should alarm every doctor prescribing prednisone. Women who experienced intolerable side effects were significantly less willing to accept a dose increase if their symptoms worsened. Only 26% of women said they'd be willing to increase their prednisone dose compared to 44% of men. And women were much more likely to report that their steroid dose had been lowered, specifically because of side effects. What does this mean in practice? It means women are getting inadequate treatment for their underlying conditions because the side effects are so intolerable. They're living with worse disease control because the medication that was meant to help them is making their lives miserable in other ways. Previous analysis of the same registry showed that women were less likely to be on current prednisone treatment, despite having worse severity ratings of their disease compared to men. This study helps explain why. And when I was at Harvard, learning from a Harvard professor, he specifically said that prednisone fails women. He was specifically talking about a disease called giant cell arteritis, or GCA. And he was trying to figure out, was there a golden dose where there was enough prednisone to keep the disease under control, but not enough prednisone to make the side effects awful? And they found that there was no golden dose, that the dose of prednisone required to keep the disease at bay was higher than the dose at which side effects start. That no matter what, there's going to be awful side effects for women specifically. That we need more from doctors, from researchers, because this is not a bargain worth doing for so many people. Intolerable means I cannot tolerate it. I would rather have my disease. And in myasthenia gravis and giant cell arteritis, that might mean going blind. That's not what anybody wants. But the side effects are that bad. So what should be different? Based on this research, here's what we should change in our approach when it comes to women. Number one, doctors should dose by body weight. Doctors should be calculating dose based on actual body weight or ideal body weight, not just prescribing standard prednisone doses. Most of the standard doses out there are just kind of made up. Like, oh, 20, that sounds like a nice round number. Women generally need lower absolute doses to achieve the same effect. I'm grateful that when I was hospitalized and prescribed prednisone, that my doctor did do that. My doctor prescribed 1 milligram per kilogram of prednisone, exactly what I needed to get my disease under control. Number two, take appearance-related side effects seriously. When a woman says to her doctor that moon face, weight gain, hair loss, acne are intolerable, that's not vanity. That's a legitimate concern that affects compliance, as shown in this study, and quality of life. And it's not just that. There's actual evidence by Professor Fardet, a researcher in France, showing that these symptoms that seem like cosmetic or vanity issues are actually symptoms of metabolic dysfunction. If a person has moon face and weight gain, they're more likely to have increased risk for diabetes and heart disease side effects from prednisone. So they're not just vanity things, they're actual symptoms of metabolic dysfunction that doctors absolutely need to take seriously. Number three, proactive management. Don't wait for side effects to become intolerable. Start protective strategies early. The doctors say every woman and man on prednisone should be taking calcium and vitamin D to protect your bones. Do it. We should be monitoring our blood sugar and our blood pressure. Discuss weight management strategies with your doctor and consider other medications if needed for side effects. That's what my prednisone checklist is for. It has those strategies and you can just check them off one by one. Just click the link below to download it now. Number four, consider steroid-sparing alternatives sooner. If a woman is experiencing intolerable steroid side effects, that's when it's time to talk about immunosuppressants, biologics, and other treatments for the disease. So what you can do right now, if you're a woman taking prednisone and experiencing awful side effects, here's what you can do. First, document everything. Keep a list of your side effects and rate how much they're affecting your life. Don't minimize them. If something is making you miserable, write it down. Here's my drawing of what I felt like while on prednisone. It was very unpleasant, and many of those were intolerable side effects to me. The alternative was dying, bleeding to death, so I kept doing it. Gratefully, I had an honest conversation with my doctor. That's step two. You can use language from this study if it helps. Specifically, you could say, research shows that women experience more intolerable side effects from prednisone, and I'm one of them. Frame it as a medication problem that needs a solution, not a personal failing. Next, ask about dose optimization. See if you can get on the lowest effective dose of prednisone for your condition. Is your dose based on body weight or just some random number in a textbook? Fourth, discuss steroid-sparing options. That's what I did. I asked, is there anything else we can do to reduce my prednisone dose? What other treatments could I be on? Is there a reason we're not trying them? And I was given the option between cutting out my spleen or going on chemo. I chose the chemo, and thankfully it worked, and I still have my spleen. Finally, number 5, if prednisone side effects that are related to your appearance are bothering you, and they're affecting most women on prednisone, ask about specific interventions. There are some medications like possibly spironolactone may help with fluid retention and moon face. Metformin may help with metabolism and moon face and weight. There are herbs like berberine, minerals like chromium, things that can support you. Work with a nutritionist and get the support you need. But what if your doctor dismisses your concerns? I know some doctors are going to hear you say, I can't tolerate my appearance changes, and they'll think you're just being superficial. This isn't a medical concern. If that happens, you can try educating them about this research. Send them this video. But if they're not willing to take your concerns seriously, find a new doctor. You deserve a healthcare provider who understands that tolerability affects compliance. Compliance affects outcomes, and outcomes are what actually matters. This study was published in a peer-reviewed neurology journal, specifically because this issue is medically significant. It's not cosmetic, it's not trivial. Women are undertreated for serious diseases because the side effects are intolerable. And that's a medical problem that needs medical solutions. The real message here is that women experience more often and worse side effects than men. They're more frequent and more severe in women. The side effects that matter most to women, the ones related to appearance and social functioning, have been historically dismissed as cosmetic or psychological, when they're actual real barriers to effective treatment. 95% of women on prednisone experience side effects. 77% find them intolerable. These aren't rare, edge, possible cases. This is the typical experience for most women on prednisone. And here's what's most important. When the side effects become intolerable, women stop being able to take adequate doses of this medication, which means the underlying diseases get worse. That's not acceptable. We need better strategies, individualized dosing, serious attention to steroid-sparing alternatives, and doctors who take these concerns as seriously as they take any other medication side effect. If you're a woman dealing with prednisone side effects, you're not alone, you're not being dramatic, and you deserve better treatment options. Share this video with other women who need to hear this. And check out my next video that is one I've made in the past with other research that they've published about women and the prednisone side effects that are more common in women. Today, I really only shared the results of one study, but there was another one I've discussed in the past. So check this video out now so you can discover what other side effects women are more likely to experience than men. And drop a comment and let me know. Have you experienced worse side effects than the men in your life? Has a doctor ever dismissed your concerns about medication-related side effects? I want to hear your stories. Signing off as Dr. Megan, your prednisone pharmacist. Watch that other women video now.